normal menstrual cycle should happen roughly once a month, though not everybody is going to be very predictable. A normal menstrual cycle will last anywhere between 25 and 35 days, with the period itself lasting between 3 and 7 days. The period should be light to moderate bleeding, and you might have some mild cramping but should not have any severe symptoms. Having a normal menstrual cycle is very important to your overall health because changes from that normal cycle can indicate issues that you're having elsewhere that we might need to address. PMS is a syndrome where people can feel both behavioral and physical changes in the days leading up to and including your period. There are several different treatments for PMS depending upon what your symptoms are. If you're having bad pain or cramping, certain types of medications that block inflammation or birth control to help suppress your periods can help with those symptoms as well. PMS can also include mood symptoms such as irritability, sadness, mood swings, and those things can be treated by exercise, by therapy, and sometimes by medication if you need them. After having a baby, it's normal to bleed for 3 to 6 weeks after you deliver. However, the return of normal periods varies a lot on patient and also whether or not you're breastfeeding. So if you are postpartum and you're having heavy bleeding when you're soaking through pads in 1 to 2 hours, or if you're having longer periods than 3 to 7 days, or with significant pain, that's always a reason to come back and see the gynecologist. Once you stop breastfeeding, if you don't see a return of your period, that is also a reason to come in and evaluate why those periods aren't starting to cycle like normal. Periods can be irregular for many different reasons. One of the most common causes is age. So as you are starting your period and as you're getting closer to menopause, you can notice changes in your cycles. Other common causes that can make your periods irregular are hormonal imbalances, medications, thyroid problems, and other disorders such as PCOS. The transition between normal periods to menopause can be different for every woman. Some things to look out for is that you might notice your periods either getting longer apart or having irregular periods that are more frequent. Sometimes they can be heavier than normal or they can slowly get lighter as well. That transition to menopause can last anywhere between 5 and 10 years. And most often you notice other symptoms before you notice a change in your periods. Things like mood swings, irritability, trouble sleeping, changes in your sex drive, hot flashes, night sweats, and changes in your metabolism as well.